Hi, today I'm going to teach you how to do a stand pivot transfer from a high surface to a low surface. A common clinical situation where this would happen is going from a bed to a wheelchair. And this skill is most useful when the patient is able to stand with minimal assistance but is unable to walk. And I'm going to show you the general guideline of how to do the transfer, and then I'll show you 3 patient-centered modifications. Start by bringing your patient to the edge of the bed, and you can refer to the bed mobility videos on how to best do that from their starting position. Make sure that the wheelchair is close by, as close as you can to the patient, and have it be parallel with the bed. You can refer to the wheelchair adjustment videos on how to remove the closest armrest and both feet rests. So start by placing one foot in between the patient's feet and have your knee in contact with their knee. This is called locking the lower extremity, or bracing the lower extremity. And there's multiple techniques which I won't get into right now, but there are out there, and you can find those as needed. Have your other foot be back here, a couple of feet behind you, so you have a wide base of support. This hand, furthest from the wheelchair, will go under the buttocks, and the other hand will go on the scapula. Instruct the patient to place their head on your shoulder. If they choose the shoulder that's closest to the wheelchair, they'll be able to spot their landing. If they choose the shoulder that's further from the wheelchair, then you, the physical therapist, will be able to spot the landing. Your decision on which shoulder they should rest their head on should be based on their condition and also their cognitive ability. So you want to keep that in mind. Also instruct the patient to wrap their arms around your back, not your neck, and make sure that they know that the hands are only there for stability and not for them to pull on. So we'll just demonstrate that. I'll be under here, and just like that is the good starting position. Ready, Meg?
Mm-hmm.
1, 2, 3, up. If the patient has weakness in one leg, the transfer will look very similar to what we just did, because the patient will be encouraged to use that weakened leg during the transfer. If the patient has a non-weight bearing injury, such as a broken foot bone, then the transfer will look different. In this case, we'll call the right leg of the patient here is non-weight bearing. I'll come in with the same technique, and the only difference is that patient will keep their foot off the ground, and me as the physical therapist will be making sure that that happens as well. So on the count of 3, 1, 2, 3, up. And that's that transfer.
And that's a stand pivot transfer, folks.
Yep.
Oh man, hold on.
Yeah.
That's
I'm videotaping. Haha.